This is our weekly coaching call. And today we're going to talk about why people pay for expertise in the wellness world. So, I'm going to start with a real story because this is exactly what we're talking about today. So, I have a neighbor, she's in her 60s. She wanted to feel better, not just look better, but feel better inside and out, more energy, lose some weight, feel like herself again. So she found a wellness program online that was offering a discounted weight loss plan. Now, on the surface, this sounded like a win to her, right? But what actually happened was there was no real consultation, no comprehensive medical history, no lab work, and no education at all. She paid her money, she put her credit card in, and she was given a medication with very little guidance. Zero follow up, monitoring, or adjustments. And what happened was that within a few weeks, she felt worse. She was fatigued and nauseous and really confused about what she was even taking and completely unsupported. So now she's just frustrated, she's scared, and she doesn't know if what she's taking is right, if what she's feeling is normal, or if something was wrong. And this is the part that I really want you to understand. She did not think she was making a bad decision. She thought she was making a smart one. She thought, oh, I found something more affordable, or I don't need all that extra stuff, and I just want the medication. And this is really where our roles come in because patients don't understand what goes into a real wellness program. They don't understand why labs matter, why dosing matters, why follow ups and guidance matter. So they default to what they can understand, which is price. And if you don't position yourself correctly, they will choose price every single time. To be clear, people are not paying more for the medication, they're paying more for how the medication is managed. They're not paying for a GLP-1 or a hormone or a peptide. They're paying for your provider guiding them, the safety of the process, the predictability of how they feel and function. The four things that patients are actually buying in wellness, number one is safety. They ask themselves if this is right for my body, is this going to harm me long term? Number two is outcome predictability. Will this actually work for me? Will I feel better? Will I feel worse? Will I lose weight? And number three is guidance and support. Is somebody monitoring them? Is somebody following up with them? Do they have somebody to go to if something feels off? Not just a bot or a doctor that they think is online. And number four is really risk reduction. People are trying to avoid side effects, wasted time, wasted money, feeling worse instead of better. So your pricing is not about the medication. Your pricing is how well you guide them through the patient process. So I'm going to talk about the deal mindset, discount driven wellness programs. They attract patients that are looking for shortcuts, patients who don't want guidance, patients who are more likely to be non compliant. And what happens is that they don't follow protocols. They don't get the results. And what they blame the treatment and they blame the provider because they don't invest in the process. They just bought a product. I can go to any department store and buy a full face of makeup, but if I don't know or am taught how to use it, I could look like a clown. So, wellness like that is not just a product, it's a process, and you cannot shortcut the process. When we talk about expertise in wellness, it's even more important than aesthetics. Expertise is knowing what labs to order, how to interpret them, how to dose appropriately, and how to adjust over time, and knowing when something is not working and how to pivot safely. Anyone can prescribe something, but very few people know how to manage it long term. Now, here's where most clinics lose. They explain what they offer, but they don't explain why it matters. So the patient is solely comparing $300 versus $99, instead of comparing guided care versus guessing or a safe process versus a risky shortcut. And that comes down to positioning, because the best provider does not always win. The best positioned provider wins. Patients don't know how to evaluate your clinical skill. So they evaluate your confidence, your presence, brand, your content. The perception is driving the price, and the perception is pricing power. Social media is not about posting, it's about positioning. If you're not educating, someone else is. And that someone else may not be qualified, but they have a pretty good script. So instead of saying that we offer a GLP-1, we want to talk about why dosing matters and why not everyone is a candidate and what happens when this is done incorrectly. This is how we build authority. And if you've ever been on any of our group coaching calls, we talk about building authority for yourself and your practice. And this is how patients are actually choosing you. They see you, they learn from you, they trust you, and then they book with you. So by the time that they walk into your clinic, you are either the expert or you're being price compared. A lot of things, insurance has changed as of January of 2026. So there are a lot of people that were getting GLP-1s that were getting it through their insurance, which is now no longer covered. So these are real people with real clinical need for GLP-1s and hormones that are no longer being covered. And so we want to make sure that we're positioning ourselves as the trusted expert and our guides to our clients. Higher price often increases trust, and cheap creates doubt. Premium creates a safety. So if you want to position yourself as the authority, we need to own our niche, show our face, speak like an expert, and stop apologizing for your price and stay consistent. I want to be really clear about something. Every single person in the clinic impacts how we're perceived. Front desk, providers, social media. We don't just build authority in one place, we build it everywhere. Every single touch point is an authority builder. So when a patient says, "Oh, I can just get this cheaper online," your response can be, "You absolutely can. But we don't just give you the medication, we guide you through this entire process and making sure that it's safe for your body and working effectively." Medication is not something that you want to guess on. Just like aesthetics, we don't want to guess on, oh my God, am I going to have a droopy brow or a Spock brow or, paralysis on my lower face? That has happened to me. I need everyone to understand this. We're not just charging more, we're reducing risk, increasing certainty, and protecting the patient. So I want you to ask yourselves, am I the best person to guide this patient? Do I have a wellness program that is mapped out and ready for my team so that we can all be educated on this? My neighbor that I was talking about didn't make a bad decision on purpose. She made the best decision she could with the information she had, and no one gave her better information. That's our job as providers, as clinics, as clinic owners, managers, injectors, to educate them and give them the right education and guide and lead them. So your patients don't just get results, but they feel safe getting there. Because when we get this right, we don't sell wellness, we're leading it, and the patients are following us and they trust you. So I'm going to take a couple of questions from the viewers. Let's see what we have in here. All right. Question. All right. Why should a patient choose our wellness program over a cheaper option? Okay. I want you to talk to your clients and your providers about how we guide through the entire process. And we're not just providing that medication. We're evaluating, we're monitoring, adjusting, and really taking responsibility and ownership for our patients' outcomes. Okay, Okay, what are patients actually paying for? Okay. A lot of people are going to want to go online and they're going to see a million ads for 149 a month, 99 a month, 349, whatever that is. But that has no clinical oversight. There's no personalization or ongoing support. It's just access to a product. And these are real medications. These are real medical prescriptions that we are writing. And so we want to make sure that that clinical oversight is on point. We have all our I's dotted and all of our T's crossed. Let's see. Oh, what's a risk of choosing a cheaper option? Good question. Everything. Incorrect dosing, lack of monitoring, uh, poor outcomes, right? People are not getting the right information and they're dosing themselves and it's not going to be a good outcome, whether they're exceed where they should be or whether they are reining it back. Ooh, lots of questions coming in. I love this. All right. What does expertise in wellness look like? It's really knowing how to assess, adjust, and guide a patient over time, not just write that prescription. Why do patients choose cheaper options? That's because they don't understand the difference yet. And if we don't educate them, they're going to default to price. What builds trust before a patient walks in? We talked about this content, consistency, clearly communicating your expertise, whether this is in aesthetics or in wellness. This is so important. Let's see what other questions we have coming through. If you have any questions, drop them in the chat. Let's see. We have lots of people here today. Red Velvet, Seacoast Aesthetics, Lola Med Spa, Derma Aesthetic Consulting. Hello, hello. One more question. Okay, how do I respond to I can get this cheaper? Okay, this is an easy one. You absolutely can get this cheaper. The difference is that we guide you through the process and ensure it's safe and effective for your body. And I cannot stress this enough. With the change from insurance not no longer covering GLP-1s for weight loss as opposed to diabetics, we are at a crucial turning point where GLP-1 clients are flooding our clinics. And so we need to show them that as opposed to going through their actual PCP, we are as educated, as on point, as knowledgeable as those physicians that have been previously prescribing. And we want to make sure that our wellness programs match that. So if you are looking to launch a wellness program, expand a wellness program, or scratch the surface because we have somebody who's just, prescribing some GLP-1s, we want to really build out that program so that not only is your front desk aware, not only are your providers, but your estheticians, every single person in that clinic should be educated on this. And this is really ensuring safety, effectiveness, and guiding that process. Your front desk has more touch points with clients than anybody else. They see them when they arrive, when they leave. They're on the phone with them, scheduling those appointments. And so to be able to educate and to be able to have everybody in the same workflow, in the same talking points, and really answering all the questions that your providers need, that is crucial. If you fully believe you are the best person to guide this patient, would you show up differently? Yes, absolutely. We want you to be confident, direct, educational. I want you to lead instead of explaining. And how are we layering our wellness program with our aesthetics program? How do we marry those? How do we get your GLP-1 only client working with Sculptra and microneedling In 10-pound increments, we have seen scientific data that you are losing significant amounts of collagen in 10-pound increments. We need to marry this all together. This is not just about selling wellness. It's about leading people through something that they don't fully understand yet. And when we do that well, we do not compete on price. This really becomes the standard of our clinic. Do we have any more questions from the audience? Let's see. Okay, well, I am not seeing any more questions, but if you are interested in our wellness blueprint, please comment wellness if you're a viewer on Instagram, and we will send it to you. If you are in the chat, please enter your email and we will get that over to you. This wellness profitability blueprint is the starting point of how we can successfully, safely implement GLP-1s, hormones, peptides into our clinics. Every single state is different. Every single state has different laws, and we want to make sure that we are compliant to a T and that we can execute well throughout our clinic, from front desk to the physician. And if you loved this training, make sure to share this with your team. Share it with another med spa that could benefit from it. We can always catch the replay on our YouTube channel. And to get access to more free training that will help grow your med spa, visit our link tree in our social bio and make sure to join us live every Wednesday at 2:30 Central Time. Same time, same place. Find us on Instagram, find us on YouTube, Facebook, LinkedIn. Comment wellness in your Instagram and or drop your email in the chat in Zoom. So thank you so much, guys. Have a wonderful rest